All right, let's go ahead and get started so we stay in the 30-minute lunchtime. Thank you all for coming today for our Lunch and Learn here. Also, I just wanted to properly introduce Melissa Walls. She is our Health Aware Coordinator for Jackson General Hospital. She has been a nurse for 23 years, and she has a husband, Bart, and 3 kids. So, Melissa, I wanted to go ahead and introduce you. Thank you.
Thank you, Tiffany. And for those of you who don't know, Tiffany Forbes is our Employee Wellness Coordinator, and she's done such a great job in lining up all the classes that everybody keeps asking about. And if you haven't noticed, the calendar's getting full, and we've got lots of great things coming that you can check the Employee Wellness page that I'm sure you had to go on to sign up for this event today. So thanks for coming. I'd just like to start everything out with giving away door prizes, so we're going to do that really quickly as soon as they bring me the box that has all the names in it. So while we're waiting on that, I do have handouts for pretty much everything that I will go over today. There will be something at the table as you leave. We didn't give that ahead of time, so y'all will pay attention, hopefully. And so maybe if you want to pick up some resources, you can. Basically, Tiffany asked me to do this in recognition of Heart Month. This is a talk about knowing your numbers. I know on the internet you probably read what we talk about, how we know so many numbers these days. We know our Social Security number, our cell phone number, our work number, our home number, our kids' numbers. And there's some very important numbers that we need to be focusing in on, and that would be your ABCs. And we'll talk about that a little bit as we go on. This is the prettiest picture of a heart that I've really ever seen, and basically it's just showing all the arteries and all the blood supply that goes to the heart, and that's illuminated in a heart catheterization. This is what it looks like when you have a heart attack, and basically the black section around the bottom part that you see, I'll try to point if I can, but this whole area is considered the part that is dying or has lacked blood flow. And what happens in this is a picture of a heart catheterization, and basically you can see where this arrow is pointing. You can see the way it's supposed to look on the left. That's the blood flow going all the way down and supplying the bottom part of the heart. And on this one, actually the artery is closed off due to blockage, and that causes this part of the muscle down here to die. This is what causes heart disease or heart attacks. That's called atherosclerosis, and that's the buildup of plaque in the arteries, and basically that happens when our cholesterol levels get really high and our LDL levels get high, LDL being the bad level. And cardiovascular disease is the #1 cause of death in the United States for both men and women, with stroke being number 3. So these are some really deadly statistics. Nearly 2,400 Americans die of cardiovascular disease each day, and this equates to an average of 1 death every 36 seconds. I heard it compared to like the deaths of 911 happening every single day. So it's more than 920,000 Americans will have a heart attack, with nearly half occurring without prior symptoms or warning signs. 80 million Americans have some form of cardiovascular disease. Half who die of heart attacks won't even know that they were at risk. And if left undetected, a person has a 30% chance that the first symptom will be heart attack and death. The mortality rate for heart attacks is 30 to 50%, with 50% dying within the first 2 hours. And guess how long people wait before they generally go to the ER? It's about 2 hours, some longer. This chart's really interesting. When I've seen this chart, it is in every PowerPoint I do, but it really drives home a point. This is put out by the CDC, and these were the rates between 1999 and 2003. I would venture to say it's worse now, but this is for adults ages 35 years and older, the death rates, with more being the darker burgundy. So the more people that die, and look at where we live down here. We're in the dark burgundy area. This is the stroke death rates, with the darker purple being your more death rates, and look at where we are again. And then the next slide, this is brand new. This is the CDC identified the diabetic belt, and look at where we are again. Now, when my husband saw these slides, because I have to practice all this at home, before I do it on y'all, and when he saw this, he says, "We need to move." Really, that's not the point. We really can make changes. We can make Tennessee healthier, and I know that that's part of the goal of Healthy Heights, this program that you're here for today, and also the LIFT program that's going in downtown that Lisa Piercy is over. So this is exactly why we need to sit up and pay attention and do something about all this, because this is what we know about the diabetes belt. It consists of 644 counties in the 15 states. People who live in the diabetic belt are more likely to have type 2 diabetes than people who live in other parts of the United States. Counties were placed in this if at least 11% of residents had been diagnosed with diabetes and if the counties were near each other. The diabetic belt has higher rates of obesity and physical inactivity than other U.S. regions, and if these physical inactivity rates are reduced, the CDC scientists expect that eventually the difference in diabetes rates also would be reduced. So basically, we can make a difference in being in the diabetes belt if we just begin to exercise and also watch our weight, get it into control. Speaking of diabetes, I wouldn't be doing a good job if I didn't touch a little bit on some of the symptoms for diabetes, and you need to know those symptoms. Always being tired, frequent urination, sudden weight loss, wounds that won't heal, always being hungry, sexual problems, blurry vision, vaginal infections, numbness or tingling hands or feet, and always being thirsty. Now, I know I've told this before, but I have diagnosed, when I was in nursing school, I diagnosed my husband anytime he'd say, I'm really thirsty. I would say, oh, but you have diabetes. And I've done that with my kids at home, but that would be always being thirsty, on more than one occasion, or not after soccer practice or something like that, obviously. And then some of these other things, it would be a consistent problem, not something that just happens on a one-day basis. This is a slide that I'll probably skip over for time's sake, but it just basically shows about women and cardiovascular disease in Tennessee and how it accounts for 32.4% of all female deaths. This shows back about 10 years ago that if I'd have asked in this room what you thought the number one cause of death in women was, probably a lot of people would have said breast cancer. And basically this slide shows that and this still is the case, out of all of the causes of death in women, if you added them all together, you still would only get 369,000, and we have 375,000 in a year's time from heart disease alone. These are the mortality rates for men and women. As you can tell, actually the purple line would be the men, and that's the mortality rates, the number of people dying with a heart attack or cardiovascular disease. The blue line, the one above it, is women's, and what do you notice about those? What's happening to the women's mortality rates? They're going up. That's not good, is it? Why do we think that's happening? A lot of times it's been seen as a man's disease, cardiovascular disease has. I think that's changing, hopefully. We're starting to see that a little bit. But women have more atypical symptoms as compared to men, and we do tend to take care of everybody else and neglect ourselves a lot. And then our blockages tend to be in smaller arteries of the heart, and men's tend to be in the larger arteries, which means that when a man has a heart attack, a lot of what you're seeing are the typical Fred Sanford and Sons, when he had his heart attack, he always grabbed his chest and said, Elizabeth, I'm coming to you. Well, that's what we see on TV when people have heart attacks, and I think that's a mistake to one degree, because everybody thinks that that's what it means when you're having a heart attack, that you have to have that crushing chest pain and shortness of breath, and you have to be nauseated and throw up and break out in a cold sweat and all that. But you don't. And women, really, more than not, don't have those typical symptoms. What we tend to have, we might have vague chest discomfort. In other words, most of the women that I've interviewed in cardiac rehab who've had heart attacks will say, more often than not, for about 2 weeks prior, I just wasn't feeling good. I just was tireder than usual, or I was short of breath. Those are the main symptoms that I would interview women what they were having. They would tend to have pain in the back, neck, jaw, or stomach. Isn't that interesting? I mean, anywhere but the chest sometimes. And shortness of breath is a big one with women. If you can't do your activities of daily living, like if you normally can go to the grocery and bring all your groceries in and not get short of breath, but suddenly you're doing that, that should be a sign that something's going on and could be your heart. And just fatigue. I mean, that's, to me, I know ER doctors and nurses wish that everybody presented like the men with the big chest pain and my arm's hurting and I'm sweating. but we just really want. So what we teach people in Heart-Aware is if you have anything that changes from the waist up for a woman, you really need to be getting into your doctor and getting that checked out. So what can we do? All of this bad news, and we live in a terrible area where lots of people are dying, but we're really basically the thing that we can do to prevent cardiovascular disease is decrease as many risk factors as possible. Also, knowing your numbers is very important, which is what this class is about. And A equals A1C. This is a blood level that measures your blood glucose level over the last 3 months. Suggested level is 7%, but I know the dietitian in the room is probably thinking, because I just heard Alicia T say it last week in our MAC meeting about diabetes, that it's actually 6.5% or less nowadays that they recommend that it be at. The B would be blood pressure. If blood pressure is too high, it can cause your heart to work harder. And the suggested target for blood pressure is 120/80 or less. So that is very tight. As far as C, that's cholesterol. Knowing your total cholesterol numbers and also your HDL and your LDL. We have some handouts on these at the table, of course, but basically the total cholesterol number is a number that we measure, and we like for that to be less than 200. And then for your HDL, that's the good cholesterol, and that's the cholesterol, the good part that takes the cholesterol that's in your artery floating around back to the liver to be excreted from the body. So that's why we want that to be a large amount, and we would like that to be in the 60s, 55 or greater. And if you have family history and other risk factors, the higher the better on that. Good news is the way to increase your HDL is through exercise. So that's why we really want to increase our exercise level. And one of the cardiologists told one of our Heart-Aware patients, as I was teaching her one day about it, that she had been asking him how to raise hers because she has that chronically low HDL due to genetics and whatnot. And he told her the treadmill, walking would work, and the elliptical machine, if you're in a gymnasium like what we have here on campus. Those would be your two best ways to get that heart rate up as high as possible. And LDL is the other level that we look at. That's the bad level of cholesterol. So we look at it like the healthy is the HDL, H for healthy, and LDL is the lousy. So we want that to be less than 100. So those are the numbers that we're looking at as medical professionals that y'all guys need to be looking at and knowing your numbers about. These are some of the major risk factors for heart and stroke. Basically, age becomes important. When men get to be 45 or older, they become at higher risk for heart disease, and women at 55 or older. And that's because most women begin to go through menopause at about that time. And menopause, once you go through that, that puts you at higher risk for heart disease. Family history of heart disease or stroke. If you're a current cigarette smoker, I hope not, but if you are, that definitely, I can't tell you how many patients I've interviewed upstairs teaching for cardiac rehab who were smokers, and they had stents and bypass surgery and all that. So I pretty much tell people when I go out to talk that if they're smokers, they will see us at the hospital. And high blood pressure, if your blood pressure is greater than 140/90, or your own antihypertensive meds, that can put you at higher risk. And then your low good level of cholesterol, or the HDL, being less than 40 puts you at higher risk, and diabetes is a big risk factor. And there's just a few more. Obesity and abdominal obesity, or your waist circumference, is a big measurement. If your waistline is greater than 40 inches for a man, greater than 35 for a woman. And then physical inactivity. If you're not exercising 5 or more times a week, then that's considered a risk factor for you. So Ben Franklin said, an ounce of prevention is better than a pound of cure. And so what we want to do is give you the hope of what you can do to prevent, hopefully, getting diabetes or heart disease by making some lifestyle changes. One is don't smoke or use tobacco. Number 2 would be exercise for 30 minutes most days of the week. Eat a heart-healthy diet, maintain healthy weight, and get regular health screenings. And this is some healthy benefits of exercise. It will help protect you from heart disease, stroke, high blood pressure, diabetes, obesity, back pain, osteoporosis, and improve your mood and reduce stress. So when we see that list, I don't know why we don't all do it more. I guess it's just because we don't take the time like we should. Some other benefits to exercise would be that it helps to prevent heart disease and stroke by strengthening that heart muscle. It helps to lower blood pressure. It raises the good cholesterol and lowers the bad cholesterol. It improves your blood flow and increases the heart's working capacity. How much, how often? That would be, the American Heart Association says 30 minutes, 5 or more days a week to make about 2.5 hours per week of physical activity. And that would just be something that gets your heart rate up. I know in Healthy Heights and in Heart Aware, a lot of people try to count what you do on a daily basis in your job. And unless you walk consistently for 30 minutes and not stop, then that really doesn't count. So really usually don't count what you do while at work. And just a funny about exercise, it's the poor man's plastic surgery. So you don't have to pay lots of money, just start exercising. Here's another one. If you still look cute at the end of your workout, you probably didn't train hard enough. I tried to Google a good picture on that, and then some bad things came up. When I Googled workout, I was looking for a girl in a ponytail with sweat or whatever, but it wasn't good. And why exercise? Studies show that for every hour of walking, you may increase your life expectancy by 2 hours. And so that's really interesting, and that's something that I've taught my kids. And when we go walking in our neighborhood, I know one time my 11-year-old son asked me when we finished our 35-minute walk, "Now, Mom, how many hours did we just add to our lifespan?" And I said, well, hopefully an hour with that 30-minute walk, but something that you really need to do with your family. What fits your busy schedule better, exercising 1 hour a day or being dead 24? That's so true. And those who think they have no time for exercise will sooner or later have to find time for illness. Isn't that so true? The heart healthy diet, we need to be eating a diet low in fat, cholesterol, and salt, and we need to eat a diet high in fruits, vegetables, and whole grains. And we need to eat low-fat dairy products and other low-fat sources of protein and certain types of fish. So those are the main points on a heart-healthy diet. As far as a healthy plate goes, this is what it should look like. We should put vegetables on half of our plate. And I don't know how many of you know or not, but our plate sizes have grown over the years. And actually, we really need to scale those back down. Eat on your little breakfast plates if you have Fiesta ware, and a salad plate if you have other types. But basically, half of that plate should be your vegetables, and then just a quarter of that plate should be your potato, rice, or pasta. I don't know how many of y'all do like all three of those on your plate sometimes, because we like those, don't we? And then just a quarter should be your meat, fish, or poultry. So that's really interesting. It's such a visual, but if you think about that when you're making your plates at home and when you're cooking for your family, surprisingly, last night I made green beans, and my boys came in there and said, "Why did you just do that much?" So, teaching your kids early, I had to open another can of green beans, and really and truly, we're not supposed to eat canned. I know it's lower in sodium if we do the fresh or frozen, but if you rinse your canned vegetables with water, you actually cut a lot of that sodium out. This is just a neat thing about controlling your portions. Meat should be, and I've got a handout for all of you that want this to take home, but meat should be the size of a deck of cards. How many times do you go to Longhorn and you feel offended if they came out with a little piece of meat that big? A brownie, slice of cake, or a cookie should be the size of one Post-it note. Man, that's little. Mayonnaise and butter should be the size of one dice and the size of 3 dice for cheese. So those little blocks that we get when we go to the receptions when people retire, you can only have 3 of those. And use the size of a fist for your rice and pasta, and you can have 2 fists for vegetables. For rice, pasta, fruits, and ice cream, another size you can look at is half a baseball or a cupped hand. Using a handful of measurement for nuts, popcorn, and trail mix. How many have more than that? I know I do. Sometimes, but not anymore. 10 to 15 chips equals 1 serving size. And then that is a floss box, because I couldn't find a better graphic, but that is a floss box. Use the size of dental floss box for chocolate. Now, we just had Valentine's Day, and that one's tough, but we need to try to do it. So we do have a program here at the hospital that focuses in on a lot of this teaching that we've had here. Some of you may have already taken Heart Aware. It's available today. If you would like to take a paper version of it home, you can, or back to office or whatnot. Basically, it's for everyone, but especially those at risk for heart disease. It's totally confidential, voluntary, of course, just like Healthy Heights. And with it, if you have 2 or more risk factors, you'll qualify to come in and sit down and receive education from a registered nurse in the cardiac rehab area. and that also counts as one of your educational classes. We also have many other awares. I don't think I have to go over these. It's basically a great program because it looks at everybody individual by individual and not just puts everybody. This is the website with graphics, and this is the other awares that we have available, with Diabetes Aware being our newest. We have Spine Aware, Sleep Aware, if you snore, it's not normal, and our Cancer Aware line, and then Vascular Aware. And if you take Heart Aware, you're actually taking heart, stroke, and vascular, because that's all the same disease process. This is a risk assessment report that we give each person that comes through, and we also fax a report to your primary care doctor. So we have seen so many success stories through the Heart Aware program, one of which that I can talk about because she was on our first video, but is a little lady from Martin, Tennessee, who she was having some symptoms that she thought was her reflux. Her doctor thought was reflux. And when she was talking to me, I asked her what her symptoms were, and it was basically between her shoulder blades she was having pain, and then up into the right side of her jaw. And they were treating her with Nexium, and I asked her, I said, well, Miss Mildred, and I could say that because she signed the form that I can use her name. She was on our video, but basically I said, Miss Mildred, is that Nexium working for you? And she said, no, it's not. And I said, well, okay, I want you to go back to your doctor, and I want you to let them know that, you know, the Nexium that you gave me for the reflux isn't working. And so she did that. She was very proactive, and the doctor sent her to a gastroenterologist because he just knew it was reflux. And the gastroenterologist testing with a scope test revealed no reflux. And she finally got that cardiology consult that she was wanting, and she went and she had three of her vessels were clogged, and she had to have bypass surgery. And she came all the way from Martin, Tennessee, and took part in our cardiac rehab program here. Well, she had all her surgery, everything here. And she's just a walking testimony to what we need to do as women. We need to be very proactive in our health, and men too. I'm sorry for the guys that are in here. But, you know, a lot of times when a man and a woman walk into the ER and a man complains of certain symptoms, they immediately work them up for heart problems. And a lot of times with the women, they'll say, well, you're just under stress or you have reflux. So that's the point at which we like to teach our patients to be the squeaky wheel and to always go back to your doctor and let them know what is working and what's not working. If the medicines that they give you don't work, be sure and inquire about that, and you know your body best of all. Any questions at all? I know I'm talking to people who probably already know all this, but we appreciate your time, and we appreciate Tiffany for getting this class together.
I just wanted to quickly just say thank you to Melissa for taking the time to come and speak to us, and I appreciate you all for coming and taking advantage of this Lunch and Learn. So I hope that you all are able to get all your classes in, and if you have any questions, please feel free to shoot us an email or give us a call. So thanks, guys.